Now let's head on over to the global health crisis. That's the other historic situation we're dealing with. South Africa recording just over 13,000 new cases in the last 24 hours and a further 226 COVID-19 related deaths. There's a graphic for you. Let's help you make sense of it. Perhaps worth noting is the number of tests that were conducted. 50,000 odd translates to a test positivity rate of 26.2%. It's down from yesterday, and you'll remember, it's always worth noting this test positivity rate. That's because it tells us how fast the virus is spreading in and of itself. The active caseload in the country now at 154,000.
Yeah, just going through some of the provinces there to see who is leading with infections, with new infections once again. It is Gauteng again, almost 9,000 new infections, taking up the bulk of those 13,000 new cases we logged in the country. It's followed this time by the Western Cape again. Very closely in third place is KwaZulu-Natal with 947 new cases.
Interesting story on the business day today that speaks to this Delta variant once again in Gauteng continuing to cause havoc. We're hearing now from some of the private health institutions speaking about how even they're being stretched by what's actually taking place in the province. Keep your eye on the ball. We're certainly nowhere near past the storm that is currently still moving through the province. In fact, let's hone in on hospital admissions now, get you a sense of what that's looking like across the country. In the last 24 hours or so, 711 more people admitted to the country's hospitals. In the private sector, to date, 24,000 people have had to be treated with COVID-19. In the public sector, that number is understandably and expectedly higher, 37,769 people being treated there for COVID-19 across the private sector, the public sector, I beg your pardon. It's certainly a cause for concern. Remember, again, we want to make sure that we don't reach a point of collapse, and that's why, even as vaccinations continue, it's up to you and I to practice those non-pharmaceutical interventions.
I mean, the thing about the Delta variant in particular is that it does spread so very quickly. So it means that the number of people who are getting infected, and we're seeing it in our test positivity rate.
Right.
It's a lot of people at one time, and because of the lack of a vaccine rollout, a lot of people are also getting serious illness. So in one given moment, there are a number of people that are receiving treatment in our country's hospitals.
Exactly, and with that, let's actually get you a sense of how that vaccination drive is currently panning out. Once again, get you a sense of how they look like provincially in the public and the private sector. We're seeing once again the most vaccines in the last 24 hours being administered in Gauteng in particular. Just about 23,000 of the 107,000 vaccines administered in total yesterday, and we still see the public sector leading insofar as the administration of those jabs is concerned.
Yeah, the Eastern Cape also doing quite well in terms of the number of vaccines it administered in the last day. 20,544 the Western Cape in fourth place, KwaZulu-Natal in third with just over 18,000, the Western Cape just over 14,000 vaccines. Interesting to note, 107,762 vaccines administered in the last 24 hours in the country. Again, I mean, we said this yesterday.
Yeah.
It's well short of what President Cyril Ramaphosa announced would have been our target in terms of our vaccine rollout plan, which is 300,000 a day.
So we're only at a third of that. And this is why it's worth noting every day. We had heard already as far back as Sunday that bottleneck, which is the supply of vaccines, has now been cleared. Question now is then why are we not getting to that target soon enough? If the one problem that had prevented us from being able to get to 300,000 vaccines hadn't been capacity issues, hadn't been personnel, but actual supply, if that issue has been sorted, the question then is, how quickly can we finally get to the point where we're going at our own target?
Yeah.
That's the other thing worth noting. So we'll keep watching that, and hopefully you'll do the same too, because that helps us put these numbers in perspective as opposed to just reading them out for what they are.